Hello, my name is Abigail Herreria Salguero. My topic about Chlamydia Complications. Definition. Chlamydia is a cone-sensitive transmitted disease. It is caused by the bacterial Chlamydia trachomatis. You may know you have chlamydia because many people I had no symptoms or the symptoms can infect both men and women.
What is chlamydia? Did you know that chlamydia is one of the most common sexually transmitted infections in the world? Most people with chlamydia have zero or no symptoms. The good news is that it's easy to diagnose, treat, and prevent. Why should I care? Here are the problems chlamydia can cause: painful urination, discharge, inability to get pregnant, abdominal pain, and increased risk of HIV. How do I get it? Chlamydia can be spread through sexual contact, either oral, vaginal, and penile or anal. How can I prevent chlamydia? With the use of condoms, either vaginal or penile, dental dams, or through abstinence. Does the use of condoms guarantee I won't get chlamydia? Well, the answer is no, but it will greatly reduce your risk. What do I do now? Well, if you are, or have ever been sexually active, it's important to get tested. You should get tested with every new partner, and ask your partner or partners about their sexual history, and insist that they get tested too. How do I get tested, though? See, the good news is testing is easy and available to you as a student. Samples are drawn through urine or self-swab, depending on the tests being done. You can go to the UCI Student Health Center, check out their website, or see your medical provider to get tested. There's also free, anonymous, and confidential testing throughout Orange County. Please visit the OC Healthcare Agency for locations. Hashtag Know the Facts.
Application in nursing. It is transmitted through sexual contact. It includes contact of the penis with the vagina or the penis with the rectum. It can also be passed from mother and newborn during childbirth. About 75% of the women and 15% of the men had no symptoms. Most people infected with chlamydia are where they have the infected and many now see medical attention. Symptoms may include urethral itching and urethral when urinary and discharge from the penis in small or moderate amount is woman and symptoms. They can include vaginal discharge and painful urination.
Helping make your life easier. Moms Every Day.
Good morning, I'm Katie Kunkel. The words, "you have chlamydia," are ones you hope to never hear, but unfortunately they are all too common and many people don't understand the health issues related to the disease. Today, Rhiannon Riley, nurse practitioner in the Obstetrics and Gynecology Department at Mayo Clinic Health System, is going to talk with us about chlamydia and how it can lead to fertility issues for women. Good morning, Rhiannon.
Good morning.
So first of all, what is chlamydia and what are the common symptoms?
So chlamydia is a sexually transmitted infection, and it is commonly asymptomatic, meaning that people do not usually have symptoms when they have this infection. If you do exhibit symptoms, they can include abnormal vaginal discharge, pelvic pain, abnormal bleeding, and also pain with urination.
Okay, so how common is chlamydia?
So chlamydia is the most common sexually transmitted infection, and in 2013 alone, 1.4 million people were diagnosed with chlamydia in the United States.
Okay, so who should be screened then, and what can we do to prevent it?
So chlamydia screening really should be focused on younger women especially. They are at 3 times more risk for developing chlamydia in their lifetime, and we do recommend screening for women 25 years and younger, also with screening with new partners as well.
Okay, and so what are the possible long-term consequences of the disease?
So long-term consequences from chlamydia can include pelvic inflammatory disease, ectopic pregnancy, infertility or difficulty getting pregnant. Also, there can be infections in pregnancy that can lead to problems with the newborn as well.
All right, so very important to get screened. Thank you very much for joining me this morning. And to learn more, please visit weau.com and click on Moms Every Day. You'll find more information in the health section under Women's Health.
Get
Pros and cons. Pros can be cured with a simple round of antibiotics. A diagnostic test is also performed of the is those that show serious symptoms. Cause is cause problem is pregnancy. It is asymptomatic. It's called the detect lead. I can have serious complications.
What is it, and how does it spread?
Well, chlamydia is, as we explained earlier, is also a sexually transmitted disease. Is caused by Chlamydia trachomatis, and it's so common and so persistent because it's a silent disease. You could have it forever and don't know you have it. And the most likely is sometimes you get a clear discharge, vaginal discharge, but that is so many it's so common for women to have discharges that they don't even notice that they have this. So nowadays the recommendation is that anyone gets before the age 24 gets a screen for a chlamydia infection. And it's very simple to be screened for a chlamydia infection. You could do it in urine, you could do it through a cervical swab. Why is this so important? Because the chlamydia is something that you pass from one partner to the next, especially in people who have multiple sexual partners. And chlamydia, even though it does not cause any particular severe infection, it causes a lot of issues with infertility later on in life. It affects the fallopian tubes and could predispose to ectopic pregnancy and other complications that are associated with it.
Yeah, I wanted to get to that too because you mentioned infertility, but there's a number of complications here with chlamydia I don't think people would immediately think about.
Right, exactly, especially because it's such a silent disease. It's going to cause pelvic inflammatory diseases and inflammation of the pelvic cavity. Infertility because it affects the fallopian tubes. The fallopian tube have a cilia, which is what allows the motility of that sperm to travel and the egg to travel and meet the sperm. And when that cilia gets affected somehow, it predisposes to ectopic pregnancy. What happens with ectopic pregnancy? Well, ectopic pregnancies are those pregnancies that occur outside the uterus that could rupture, and it's an increased risk of maternal mortality. As well as pregnancy complications, chlamydia infection could predispose to preterm labors, and newborn complications. Well, babies are born, they use antibiotic on the eyes, and the reason is to prevent chlamydia infections.
Can chlamydia, I guess, we're always talking about cures. Is this something that can be cured?
Yes, chlamydia is cured as opposed to any type of other things that we discussed, herpes or HIV. Chlamydia is easily cured with an antibiotic. Citromax covers quite easy. Now it's important that not only you get treated, but your partner gets treated, because otherwise the infection comes back.
In South in Ecuador, sexually transmitted disease has become a full problem. It is has happened because each time the beginning of sensitive activity is early. In our country, 59.3% of the women and 75% of the men aged 15 and 24 has already had something sensitive experience.
Hi, I'm Dr. Edwin from DTAP Clinic. Today we are going to talk about the signs and symptoms of chlamydia in men and women. Chlamydia is one of the most common bacterial sexually transmitted infections worldwide. It is caused by a bacterium called Chlamydia trachomatis. The reason why chlamydia is so common is because most individuals with chlamydia do not have any symptoms. In fact, less than 50% of both men and women with chlamydia develop symptoms. Asymptomatic individuals may be unaware that they are infected and continue to spread it to their sexual partners. If symptoms do develop, they may occur anytime from days to weeks after the initial infection. Symptoms of chlamydia in men include dysuria or painful urination, urinary frequency and urgency, discomfort along the urethra or urinary tract, penile discharge, pain or swelling of the testicles due to a less common but serious infection known as epididymoorchitis, pain or discomfort in the pelvis due to prostatitis, which is inflammation of the prostate gland. Symptoms of chlamydia in women include abnormal vaginal discharge, which may be different in color, odor, quantity, and consistency, bleeding after sexual intercourse, abnormal spotting or bleeding in between menstrual periods, painful sexual intercourse, chronic pelvic or abdominal pain and/or fever due to a complication known as pelvic inflammatory disease, whereby the infection spreads upwards to affect the uterus and fallopian tubes. There are other complications of chlamydia that can affect both men and women. Firstly, conjunctivitis, which is an infection of the eye lining, can occur after contact with infected fluids. Symptoms include eye discharge, irritation, redness, and lid swelling. Next, proctitis, which is inflammation of the rectum due to anal sex, usually does not cause symptoms. If symptoms do occur, individuals may experience rectal discomfort, discharge, or pain. Lastly, oral chlamydia, which results from providing oral sex, again usually does not cause symptoms. If symptoms do occur, individuals may experience sore throat, painless sores in the mouth, tonsillar swelling, and painful swallowing. Chlamydia can be tested using urine or swabs from the throat, rectum, cervix, and urethra. Rapid testing is available at our clinics. Treatment involves a course of oral antibiotics to eliminate the bacteria. Thank you for watching. I am Dr. Edwin from DTAP Clinics.
For more information about
Conclusion. It is a condition that fortunately can be treated as with antibiotics, can be assessed test and normally does not have symptoms. Chlamydia cannot be treated in casual contact. The best way of preventing infection is the use of condom. Really having sex if you are a sexually active person.
Hello, I am Dr. Rachel Gorwitz, Medical Officer in the Division of STD Prevention at the Centers for Disease Control and Prevention. Although most chlamydia cases reported are among teens and young adults, any sexually active person can get this sexually transmitted disease, or STD. In fact, CDC estimates there are nearly 3 million new cases of chlamydia each year. People get chlamydia by having vaginal, anal, or oral sex with someone who has this STD. Most people with chlamydia have no symptoms, which is why the infection often goes undiagnosed. If symptoms occur, they may not appear until weeks after having sex with someone who is infected. Women with chlamydia may have an abnormal vaginal discharge, or burning sensation when urinating. Men with chlamydia may have a discharge from the penis or a burning sensation when urinating. Even when a chlamydial infection does not cause symptoms, if left untreated, it can go on to cause pelvic inflammatory disease, chronic pelvic pain, or make it difficult or impossible for a woman to get pregnant. CDC recommends that sexually active women under age 26 be tested for chlamydia every year. It is important for both men and women to discuss their sexual history with their physician to determine if they should be tested for chlamydia. Chlamydia can be cured easily with antibiotics prescribed by a healthcare provider. Even after treatment, though, a person can be reinfected if they have sex with someone who has chlamydia. So it's important that sex partners are also treated. Learn more about chlamydia and other STDs at www.cdc.gov/STD.
Thank you.